It's important for regulating our immune system. When we regulate our immune system, we turn down inflammation. It helps to turn down inflammation. It lowers inflammatory cytokines like tumor necrosis factor alpha and interleukin 6 and boosts anti-inflammatory cytokines such as interleukin 10.
Hey, Kyle Colbert here, and this is Dr. Colbert's broadcast. I'm here with my dad, Dr. Don Colbert, and my mom, Mary, and we just talked about thyroid. And if you missed that show, go back, make sure you watch it. There's some key information about getting your thyroid healthy. But today we're talking about...
I believe this is the most important vitamin anyone can take, and it's simply vitamin D.
Yeah, and you know what? This is the last show of Know Your Numbers that we're doing. We're covering the major numbers. Of course, when you do a blood test, there's tons of things in a blood test. But what we have taken are what we believed are the most important numbers that you need to know, that you can stay on top of and watch and see how you're doing. Because prevention is huge. When you know that something is low, then there's something you can do about it. But if you don't know, you don't know. This is what this is all about. And Don, we saved the last one for what I believe is like the most important number you should know.
Absolutely.
And the reason why I say this, that I really do, is that during COVID, so many people, they got COVID, very ill, got very sick. But Don and I, me, who I'm 70, next year he turns 70, we all, through all of COVID, we traveled back and forth from Orlando every 2 weeks. We were doing 2 weeks, 2 weeks, 2 weeks, 2 weeks. We were in front of tons of people, patients, people in the public, all through the whole thing. Neither he or I ever got COVID. Nothing. We never got anything.
But we kept our vitamin D optimized.
And that is my whole point. And I told Don, I said, Don, because we have been so focused, and even for little kids, if you want your children to stay healthy, and as we're going into the flu season, as we're coming up, that people all expect, you keep your children's vitamin D optimized, everybody else will get sick, but they won't. It's your first defense against the flu. It's your immune system booster. This is the one you really want to make sure you know.
Now, I check this in every patient. I check the most accurate way to check your vitamin D level is to do a 25 OH-D3 level. And I've been doing this for many years on my patients. And I check everyone, and I try and get that level optimized to a level of 50 to 80 nanograms per ml. And so that literally is the sweet spot that is really good for the immune system. It regulates our immune system. It helps to improve the absorption of calcium and phosphorus that maintains healthy bones, healthy teeth, and healthy muscles. So we have to have those, and also prevents osteomalacia or softening of the bones. So it's critical for healthy, strong bones is that vitamin D level at that amount. But also it's important for regulating our immune system. When we regulate our immune system, we turn down inflammation. It helps to turn down inflammation. It lowers inflammatory cytokines like tumor necrosis factor alpha and interleukin 6 and boosts anti-inflammatory cytokines such as interleukin 10. It also affects this nuclear factor kappa beta. This is a bad actor. Nuclear factor kappa beta is actually an inflammatory gene expression involved in inflammatory gene expressions and is a driver for many cancers, for autoimmunity, and for chronic inflammation. And so when you turn that down, you are turning down inflammation. And so that's what vitamin D helps to do. It helps to turn that bad actor off and lower inflammation in the body. And so, again, the other thing that vitamin D is so important is keeping our immune system functioning well. And it helps the body fight off viruses and bacteria. And when you optimize it, it also helps decrease your risk and severity of the flu. And it also especially is good for the elderly and those with weakened immune systems. So for those elderly patients, again, getting that vitamin D between 50 and 80 is critical. And so many people used to have real low vitamin D levels, but since COVID, I've had all my patients on high levels. I had to get them on 5 to 10,000 units of vitamin D a day for a while. Now, most of them have their vitamin D levels normal. When I see them, they're optimized between 50 and 80. But if they're not patients of mine, their levels are really low, and especially in my African American patients, many of those are extremely low, and that's opening the door for viruses and bacteria.
I just did my blood test and mine's 55.
So you're optimized.
So
You're good.
mine's good,
And you've
yeah.
got yours optimized because you've been taking vitamin D
Yes.
supplements, or because you've been going outside, or both, or
Well, we live in Florida too, so
that
and I go and play outside. I play pickleball outside,
So she doesn't have.
and I ride my bike on the beach, so I'm a beach lover. So I'm sure he doesn't go in the sun. He stays
So
away from the
I take
sun.
her.
why don't you go in the sun?
He had
I
a
do a little bit.
stroke.
But
He
yeah,
had a
but heat
massive heat
stroke.
stroke in med
When he was
school.
in college.
When I was
So
in
his
I
thermostat.
take our
gets over-
hormone zone, and our hormone zone, I take one twice a day. That's 2,000 units.
Yeah.
It also has the K2 and the DIM in it that protects the prostate for women. It helps, or it supports a healthy prostate, supports healthy breasts. So
I
I
take
get all
our
three.
multivitamin. That's what I take. The
Because there's
multivitamin,
D3 in there.
it's
There's
got the
D3,
D3
but-
in there, and that is all I take to keep my vitamin D high.
So you get probably most of your vitamin D from the sun.
I do from the sun and our multivitamin.
Isn't that incredible, though? God created our
No.
bodies
Now, what's
to boost
amazing,
their immune systems naturally.
but as we age, and when people are 70, they have 50% the ability to convert sunlight to vitamin D. A
See,
20-year-old can convert much more, so it drops significantly. So people that are 70 usually need to support their bodies with.
is it because we
with
get
a
leathery
supplement.
skin?
It
We
just
get that
doesn't
thick
work.
skin.
It's because of this hydrocholesterol in the skin is what converts to vitamin D. And we don't have enough of that in our skin, the hydrocholesterol in the skin, to convert to vitamin D.
Oh, wow.
So that's how it works. There's a rhyme or reason to most everything. But we find that vitamin D is critical for the brain. It protects the brain from neurodegeneration and memory problems as we age. And the research is pretty amazing. The vitamin D is found in the brain's memory center, the hippocampus, which is right above the ear, is the short-term memory center. And they're found abundantly in the prefrontal cortex, which is the long-term memory center. Now listen, it's involved in neurogenesis. It actually starts to restore the nerves, the brain cells in these memory centers. And here's how it works.
Oh, wow.
Vitamin D promotes neurogenesis and enhances synapse formation in these memory centers. When the synapses, that's where the connections between the axon and dendrites, and it releases acetylcholine, which is the neurotransmitter, how the brain communicates. And so it helps to improve those synaptic connections. How the brain's like a huge tree with all these connections. And so it improves the connections, and it literally regenerates neurons. That's what vitamin D does. So that's absolutely amazing. It also regulates nerve growth factor, which repairs those neurons in the brain, and it also helps with neuron development and function. So, and it also lowers oxidative stress in the brain that's associated with neurodegeneration. See, all that oxidative stress, all those free radicals produced, especially when we eat a lot of sugar, it ages our brain. Sugar ages the brain. So does excessive processed carbohydrates, bad fats. Well, this literally helps to clean up that oxidative stress in the brain. The vitamin D does. It cleans that up.
Okay, so Don, the best way to boost vitamin D, in your opinion, for everybody really is to supplement.
Oh, absolutely. Now, again, like
Okay.
I say, as we age, we cannot convert the.
Even with the young people, though.
Yeah,
Young
well,
people
young
should
people can convert it pretty good.
right,
there.
but should
But
they
most people don't
supplement?
live in Florida and Texas where it's warm on the beach.
Oh, it's a good point. So during the winter, they're not getting vitamin
They're
D.
not getting-
They're much more susceptible to viruses.
And the kids aren't outside, and
That's a great point.
Exactly.
their skin is all covered up
Right,
with
exactly.
sweaters and
I bet there's a
sweatshirts.
correlation. The more north you live, the lower your immune response is, or the lower your
And
That's
higher
vitamin
north,
D.
they've done this. They find when people live up north, they have lower vitamin D levels, they have more autoimmune disease, And they have more, they're
It's
more
all
prone to
vitamin D
colds
related.
and things like that.
It's all vitamin D related. And also, Don, you had said earlier that the Black community, that they have, you notice your patients that come in.
Now, mine are much better now, but new patients that's not been on vitamin D, many times their levels are really low.
Really,
Days are
really
really
low.
low.
And then
And they're more prone to prostate cancer.
that's what you said earlier.
Much more prone and much more likely to die from prostate cancer.
So you
Correct.
really, really stress with the Black community, they need to supplement.
Oh,
vitamin.
absolutely. We
Yeah.
put most of them on vitamin D.
And their level needs to get over 50 for
50 to
everybody.
80. Yes,
that true
50
for
to 80
everybody?
ideal, yes.
Children?
Children, yes, absolutely. Because
so-
it helps them grow.
Okay, so
It helps bone formation. It helps growth. It helps
Okay.
grow muscle and teeth, protect their teeth, make their teeth strong. See, when your vitamin D is optimized, it literally causes calcium and phosphorus to be shuttled into the bones, into the muscles, into the teeth to create strong bones, strong muscles, and strong teeth.
that's why they fortified vitamin D in milk.
Yeah, that
It's for the kids.
absolutely
That's
true.
why they did that.
That's right.
Yeah, it just,
That's right, because they don't get enough.
okay,
Or they're not outside, or they're covered up in the wintertime.
okay.
So that's why the kids need extra vitamin D. They're growing. And so they especially need it more than adults do.
So D3 is good for the bones. It's good for the immune
Teeth,
system. It's
muscles,
good for
regulate
the
the immune
brain.
system. Great for the brain. Now, the other thing it does, it helps to prevent cancers from being aggressive cancers.
Oh,
This is amazing. This is the VITAL trial. And the VITAL trial, they had participants who took 2,000 units of vitamin D a day for an average of 5.3 years, and they were 20% less likely to develop advanced cancer that metastasize or fatal cancer than those on placebo. If they took the vitamin D, 20% more likely to not develop metastatic cancer or fatal cancer.
and that's a considerable
Now,
percentage.
but
That's
listen to what happened. Listen to what happened. The protective effect of vitamin D was most protective for those with a normal BMI, but for those that were obese or overweight, they didn't have a protective effect. And the reason why, those with a normal BMI showed a 38% reduction in advanced cancer risk, almost 40% reduction in advanced cancer risk when their vitamin D was normal, while no significant benefit was seen in overweight and obese individuals, probably because excess body fat reduced the bioavailability of vitamin D.
I was going to say it counteracts.
Because
obesity counteracts.
Exactly. When a person is obese, they don't absorb as much vitamin D. It takes a long time to get their vitamin D up to a therapeutic level. So that's the big takeaway is when you have normal body weight and your vitamin D is optimized, you stand about a 38% decreased risk of developing fatal cancer or metastatic cancer.
Well, that's a big
That's huge.
percent.
That's a huge percent.
Wow.
So that's protecting your immune system. Now, 1 in 8 women will develop breast cancer. 1 in 8 men will develop prostate cancer. The top 10 cancers in the U.S. are number 1, breast cancer, number 2, prostate cancer, number 3, lung and bronchial cancer, number 4, colorectal cancer, number 5, melanoma, number 6, pancreatic cancer. I was shocked to see pancreatic that high. But pancreatic cancer.
That's insulin
Wow.
resistance.
No, it's just the pancreas is where
It regulates your sugar.
it regulates sugar, but also it's the exocrine pancreas where the enzymes, we're not producing enough enzymes. We're shutting them off with all these proton pump inhibitors. And then kidney cancer is number 7. Kidney cancers, that's mainly in smokers. We used to see that, but we're seeing kidney cancer is number 7. That's a lot. Endometrial cancer, uterine cancer is number 8. Bladder cancer is number 9. And non-Hodgkin's lymphoma is number 10. That's in 2024. So those are your top 10 cancer. But number 1 was breast. Number 2 is prostate. But skin cancer is more common. But melanoma was number 5. So the bad cancer.
Is that just excess sun?
Yeah, excessive sun. Squamous cell and basal cell are minor cancers that you can, those are easy. You can excise those or use a radiation therapy, the gentle cure for that.
Okay, but optimizing your vitamin D is going to put you in a better position to fight those cancers.
Absolutely right, especially if you're normal weight. Remember, you're much less likely now. You're much less likely to get the fatal or the metastatic cancer. It's protecting you from it. Okay, by age 70, there is a 50% reduction in the skin's ability to synthesize vitamin D to the active form of vitamin.
But that's still something. I mean, there's still 50%.
You're right. That's true.
That's
Now, there's two forms of vitamin D. There's D2, that's the synthetic form, and there's D3, that's the active form. Which do you think's the best?
the D3.
You're absolutely right.
You want it active.
Okay, studies have shown that vitamin D3 is more effective than vitamin D2 at raising the 25-OH-D3 level, or what we measure it by.
Now, what do we have in our multivitamin? Do we
We
have
have the D3.
the D3? Okay.
Now, the
so-
sun converts D2 to D3. Is that right?
No, it converts hydroxy cholesterol to D3. It's a form of cholesterol that's like a little steroid that the body converts that to D3 in the skin.
D2 is in a food form. Is that right?
Well,
So we're
D3 is a
ingesting-
food, yes. And so most of my patients do well I take 2,000 units of vitamin D to keep my level about 60
Of the
60 something
D3.
of the D3. Some people need 5,000 units a day. Obese patients may need 10,000 or more units a day.
They're having to overcompensate
Exactly.
because the obesity is
Because what happens is the vitamin D gets sequestered or hidden in the fatty tissue. So a lot of my obese patients have to take a much higher dose of vitamin D to get their levels up.
So
did not know that.
their
Yeah.
fat is very healthy, but it doesn't get to the
It
rest
doesn't
of the
get the rest of the body. It becomes sequestered or hidden fat. Isn't that something?
That is fascinating.
Now, okay, D2 is used to treat certain medical conditions like hypoparathyroidism, secondary hypoparathyroidism, rickets, and osteomalacia. That's what it's used for because
You can get a prescription for D2, correct?
but it's 50,000 units,
And
a monster dose.
It's a slow release, though. Is that correct?
But you only take it, no, it's just a regular release,
Oh,
but
it's
you only
regular.
take it once a week generally.
Uh,
But it's used to treat those conditions that are rare. Osteomalacia, rare. Rickets, rare. Hypoparathyroidism, rare. Secondary hypoparathyroidism is fairly rare. But so again, that's what it's used for because it raises that calcium level. When you have those conditions, you have low calcium, and the vitamin D pushes that calcium and phosphorus into the bones, into the teeth, into the muscles, and helps to restore these important organs that we need. We need strong muscles, strong bones, strong teeth. That's why, again, people lose teeth when they don't have enough, vitamin D, especially after pregnancy. A lot of women lose their teeth. And because, again, their calcium and their vitamin, especially their vitamin D, is low. The average person loses about 500 milligrams of calcium every day from their bones, but vitamin D,
Wait a minute. 5% every day?
500 milligrams. Yes, the average person loses about 500 milligrams of calcium every day from their bones.
Every day.
Yes,
So
that's why we need calcium every day. We need at least 500 milligrams of calcium every day.
wow, 500 milligrams. Well,
Yeah, men and women.
that like 50,000 international units? I mean, that's a lot of IU.
No, but that's calcium. That's calcium.
Okay.
So they can take our Silical 1 twice a day and get all their calcium.
Mhm.
And then the vitamin D will drive that calcium into the bones. And so we all need that calcium. Most people don't get enough calcium.
I'm not getting enough time.
And it's the right
I don't
kind
think
of
I am.
calcium.
Right. And
That
exactly.
just hit
Yeah.
me. I'm like,
So that's why a lot of women don't get it. So a lot of times I'll put them on 3 or 4 of our Silical 1 twice a day. And then it builds bone. It builds bone.
wow.
And then the foods, which foods do you think contain vitamin D?
Well, that's
Milk.
we used to source a vitamin D2 because you can only get D2 in plant-based vitamin D2.
Right. Vitamin
So there were organelles
plant-based,
back
right.
in the day. I don't know what they are today.
But vitamin D2 comes from plants, but D3 comes from animals. Where do we get it? Which foods
Chicken?
contain it? No, fish. Fatty fish like salmon.
Oh.
4 ounces of salmon contain about 1,400 international units of vitamin D. But farm-raised salmon only has 15% of that amount of vitamin.
I know every time we go in a restaurant, Don always asks,
Is it?
"This salmon wild
And
salmon?"
even if he said it's wild, do you believe him?
I know, you're right. That's true.
You may ask them and they may give you the answer you want, but is that really the right answer?
But you're to choose wild salmon over farm raised. But they supplement a lot of foods with vitamin D, like orange juice and yogurt and milk. These are generally supplemented with vitamin D. Okay, so
So
again,
wild salmon, that's because that wild salmon's getting their vitamin D. Or
also
out sunbathing.
yogurt and cereal are supplemented with vitamin D, but it's just a teeny amount. It's not that much. It's not enough to make a huge difference. So we want to take a vitamin D supplement and want to get it optimized. That is the key.
Okay.
Now,
That's good to know.
if you consume too much vitamin D, you can get excess vitamin D if your vitamin D level is greater than 100 nanograms per ml. And again, generally, a lot of people in the sun, they'll have their vitamin D over 100. But if you have vitaminosis, vitamin D, your vitamin D level is greater than 150 nanograms per ml. That can be dangerous because excessive vitamin D can raise your calcium to real high levels. And if your calcium level is too high,
Your
especially-
arteries.
well, if it's over 14, that can be a medical emergency. So usually the calcium level should be less than, 10.5.
So people need to get their vitamin D checked, get on a
Right.
vitamin D supplement, and then get it rechecked to make sure they're not.
Right, but when
overshooting.
I always check blood, I check calcium levels. If the calcium level's high, if it's over 11, I will generally, or if it's over 10.5, I'll get a parathyroid hormone test. I just found a patient whose level was 11. I sent him for a parathyroid level. It was off the chart. It was extremely high, the parathyroid hormone level. So he has a parathyroid adenoma. So we sent him to an endocrinologist to have the adenoma. There's 4 parathyroid glands around the thyroid. One of his is hyperfunctioning. So he's going to an endocrinologist to find out which one and to remove it. So, but that's a rare condition we see.
I know you see the
I
strength.
see the strangest things, you're right.
He sure
But
does.
if your calcium is too high, if your calcium is over 14, you can develop severe nausea, severe vomiting, arrhythmias, confusion, dehydration, and even a coma. It's called a medical emergency. So we check calcium on everyone, but thank goodness we've not ever had a emergency like that. Thank God,
Thank-
or I'd be sending them right to the ER.
No kidding.
But
Wow, I hope you are enjoying what Don has been working on. I want you to know my husband has been working since January,
Yes.
studying every weekend. We fly on the planes, he gathers his books and doing his research and preparing for this. This man, I'm telling you what, there is no moss growing underneath this Rolling Stone. He is constantly looking
for the answers,
for
I'm
the
finding
answers
them.
because he loves you.
Amen.
He loves his patients. He cares about you. He wants you to know the truth. He wants you to live long.
And
He wants you to live strong. He doesn't get paid to do this. He's doing this out of his love, out of the love for what he does. And I hope you appreciate it. And the best way that you can support what he does, because we're not asking for money. We don't ask for donations. We do what we do out of love. Yes, he formulates supplements and develops products, but that's to help you. It is to help you. And it's to help your bodies be stronger and for you to live longer. When he comes home from seeing patients at night with me, so many times I hear him and he just goes, I had this patient come in today, and if they'd only known this, Mary, and it breaks his heart because he sees the results of
Plus, Mary,
ignorance.
when people see me and they have metastatic cancer throughout their body, it's so frustrating because we could have usually prevented all of that. And so an ounce of prevention is worth a pound of cure. And so that's why these numbers we're talking about are so critical because, when a person has cancer, that HSCRP is almost always elevated. You know, the body will show if there's something wrong in it. That PSA, again, most common cancer in men is prostate cancer. Most common cancer in women is breast cancer. Again, if we will simply follow a healthy Mediterranean diet or a healthy keto diet, in my book, Beyond Keto, give the body what it needs, and then take a few key supplements. Vitamin D is number one. And what I do, I take my vitamin D every day. I take my DIM. DIM protects the prostate. It protects the breast. I take one twice a day of each. And so again, that it also has the K2. K2 is the second most important nutrient behind D3 because it regulates calcium metabolism, and it keeps calcium from accumulating in the arteries, and it regulates it, puts it in the bones where it belongs.
And what he has done is research, and he recommends other products, not just Divine Health, all the time to his patients. If you've ever been to see him, you know he doesn't stick with just his products. He does whatever's the best for you.
True.
And he's absolutely drives my son, who's a CEO of a company.
That's good. I think very good.
No, but he loves that. He loves that. But when you support what he's doing by buying our products, that's what you're doing. You're saying, thank you, Dr. Colbert, for doing what you're doing. We support you because you can maybe go out and find something that's inferior to our products that's cheaper, but it's not going to be as good. I can tell you that because we want to make sure our ingredients are the best. It's made here in America. It's packaged here in America. And we want to make sure that you're getting the real stuff and not synthetic stuff. So when you support Divine Health, when you buy our products, when you buy his books, that is you saying, thank you, Dr. Colbert, for what you're doing, because that really means a lot to us and our family. And we see you as a partner. That's our partners, are people who support us in Divine Health. So I hope you'll go to our website, divinehealth.com. Go on there and look at all of the articles he's done, health articles. You will see YouTubes that, maybe you haven't seen. You can click on and see. He's trying to cover everything he's ever treated.
Every disease.
Because we know so many of you can't afford to come see him. That's why we do it. That's why we're doing this. We know you can't afford to fly and you can't afford to come see him. So we wanted to put this out here for you and your family so that you could get it, not have an excuse. You won't have an excuse now. We thank you. We love you. We want you to be healthy. We don't want you, I don't want the body of Christ. I really believe this because I had breast cancer and it really rocked my world. It did for a little bit. And in that process, as I sought the Lord, it goes, Mary, my best is that you not die disease.
Amen.
You need to know that. God's best is that you not die disease. And that's why we're working so hard to try to find the answers to bring to you so that you can live long and strong.
Amen.
Well, we've got to also thank the Life Today family, Bruce, James, who have provided this first-class studio, first-class team. You don't see it, but there is an incredible team they have provided us because they support the same mission. And so thank you, Life Today.
Amen.
You have been watching Dr. Colbert's broadcast. Do you know your number? If this is the only program you've seen, make sure you go back and watch number 1 because there are over 13 numbers. Thank you for watching Dr. Colbert's broadcast. We'll see you next time.